Faith can move mountains. Radio Maria, 91.3 FM.
The voice of truth.
Hello, dear listeners. Beautiful evening to every listener out there. It's wonderful to be here once again on Life Essential Talk, where we talk about how to build a healthy marriage, where we talk about effective parenting, where we talk about family values and relationships, as well as basic, fundamental life lessons. Well, I am your host, Uche Chukwuma, and my co-host Clare Ohunayo is readily available today. Thank God. Claire, it's good to have you here today.
Thank you very much. It's good to be back.
All right. So last week we had beautiful topics with very engaging guests. If you can remember, we talked about the importance of entrepreneurship, and we also talked about unfaithfulness in marriage. Well, today won't be different. We have an exciting topic, which is cervical and ovarian cancer. We have a consultant gynecologist who will tell us everything that we need to know. Meanwhile, stay back, do not go anywhere. We shall resume in a few minutes after this musical break. Beautiful listeners, welcome back to Life Essential Talk on Radio Maria 91.3 FM. Well, like I said earlier on, we're going to talk about ovarian and cervical cancer. Cancer, when you hear the word cancer, your heart skips. Well, we have a medical doctor, actually a consultant gynecologist, who will tell us everything we need to know. Please, it's my pleasure to introduce our very wonderful guest today, Dr. Dase. Dr. Dase is a medical doctor, like I said, a consultant gynecologist at Cedar Crest Hospital in Abuja. Dr. Dase, it's very nice to have you on the show.
Thank you for having me, and welcome to the audience as they listen to our program today.
Yes, definitely they will listen. It's my pleasure to have you here. Okay, so like I said, we're going to talk about ovarian and cervical cancer, and we know that this cancer happens in female. We know that. Okay, all right. So help us, doctor, to understand this horrible disease called cancer.
Okay, cancer is a disease or a group of diseases that occurs in any tissue or organ in the body. They usually arise because some abnormal cells start growing excessively. So they grow out of control uncontrollably, and ultimately they spread from the organ where they originate to other organ, affecting those other organs they spread to, and causing ill health and finally death. So cancer is unfortunate disease conditions that usually occur, and unfortunately, apart from very few cancer, most of them are usually poorly. They have the treatment is quite restricted, limited, so the aim of most cancer is actually to prevent them or detect them early, so that the chances of survival are higher.
Okay. All right. So that is cancer. Now let's now go into ovarian. Let's take ovarian cancer first. Help us to understand the causes of this ovarian cancer, the symptoms, how we can prevent it, and the treatments. Let's start with the causes of ovarian cancer.
The ovary is the part of the female reproductive system.
Yes.
It is the organ that produces eggs required for reproduction.
Okay.
So to form babies, you need the ova, or what we call the egg, from the female, and need sperm from the male. So the ovary is responsible for producing that, and it's also responsible for producing most of the female hormones, the hormones that give femininity and also control the reproductive system, including the menstrual cycle and all that. So that's the ovary. So, like any other organs in the body, cancer can arise from the ovary. Unfortunately, the exact cause of the cancer in the ovary is not so clear, like many other cancers. But there are what we call risk factors.
Okay.
So there are conditions or situations where such people are at higher risk or more prone to developing ovarian cancer, otherwise called cancer of the ovary.
Okay.
So one of those conditions is increasing age. So the older a woman gets, the higher the risk. So especially people that are around 60 years and above, they have higher risk of ovarian cancer. At that point, most they are already above 50 and 60s. They are going into menopause, and ovary is actually no longer functional
Functional at that point,
so
yes.
the increasing risk of cancer.
Okay.
Then obesity, it's a risk factor.
Okay.
Other conditions like genetic situation, there are some genes in the body that when there's the abnormality in them, they have higher risk for cancers. So those genes, there's a particular gene called BRCA1, 2. When there's abnormality in those genes, they are higher risk for breast cancer, ovarian cancer, and even endometrial cancer, cancer of the lining of the womb. So there's other genetic issues, that conditions that are also associated with increased ovarian cancer and cancer of the colon. Colon is part of the large intestines.
Okay.
So then family history. If a woman has a woman's relative, or especially a first degree relative,
Okay.
had the cancer, like if her mother or sister or close relative had had ovarian cancer, such
There's a
person is at
possibility.
higher risk.
Okay.
Higher risk. So
Okay.
that's what we call them risk factors. It doesn't mean these people will have ovarian cancer,
Exactly.
but it just means that they are at higher risk than someone who doesn't have the risk factor. So we're talking of those family history.
Okay.
Other things like that, there's a condition we call endometriosis that puts women at higher risk for ovarian cancer also.
Sorry, what's that condition? What is it?
Okay, endometriosis, it's a separate gynecological condition where it's the normal cells that line the womb, the inside of the uterus, what we call womb. It seems like those cells are found in other parts, that the muscles of the womb and other parts of the reproductive system and outside. So means every time with the cycle, the other tissues begin to respond, like the way the lining of the womb, which we call endometrium, is supposed to respond. So because of those cells and tissues or glands being in abnormal, unusual position, so they have lots of complaints from pelvic pain, painful menses, excessive bleeding during the menses, to infertility, and a wide range of issues. So it's a whole topic for
Yes.
on its own for another day. So
Alright.
it's also a risk factor for ovarian cancer.
Okay.
Then people who have much like also prolonged period of menstruation. What I mean by this is some people start their period menstruating quite early. Let's say menses started menstruating from as early as maybe 10, 11, and menopause comes in much later.
Okay.
So you have much longer period of experiencing menstruation. So that also have a higher risk. So like I said, these are just risk factors.
Just risk
So but it also means that people with such risk factors need to understand those things and do proper health checks when
Yeah,
necessary.
we'll get to
We'll
that.
get to that,
Yes. So let's look at the symptoms now.
Okay, so ovarian cancer, it's one of the commonest in terms of cancers affecting women generally. It's like the 11th most common, so not that, but it's the 5th most common cause of death. So it means it's much more deadly than how common it is, and one of the reasons is that it doesn't have clear early symptoms.
Wow.
So in early stages, there are no clear symptoms that you say this is ovarian cancer. So they come with vague, what we call non-specific symptoms, symptoms that could possibly be from other medical conditions. Like they come with bloating, which people with dyspeptic symptoms, people with ulcer and
Okay.
others could have.
Yes.
So they could just come with vague lower abdominal pain and all this. So very vague conditions like what we call early satiety, like they eat very small quantity of food and get full. So they're not specific for ovarian cancer. So that's one major problem with ovarian cancer. So the for late presentation, unfortunately, this makes a lot of patients present late, which means when the cancer have spread significantly.
Oh.
So at that stage, yeah, there are now more obvious like symptoms. At that time, they will begin to lose weight. They may have their abdomen or the tummy could become swollen because you now have a huge mass there, or not just a huge mass, they could have lots of fluid inside, like what we call ascites. So, and as the mass grows, they become like weaker and they become ill,
Okay.
and so their their blood level will become low, we call anemia. So all those symptoms. So if as the ovarian mass grows to, it spreads to other organs, so spread to the liver and other distant organs. So before you, so they start having symptoms related to other organs. But usually at this stage, it's what we call advanced disease. So early stage, no specific symptoms, and later stage, uh, it's spreads so fast.
This is horrible. So
Mm.
how can it be treated when it gets to that advanced stage?
So
Or should I ask, can it be treated?
yes, there are treatment options for ovarian cancer. Commonly, surgery, usually they combine actually surgery and what we call chemotherapy. Chemotherapy is the use of specific medication, anti-cancer medications. So at surgery, the aim is usually to go and remove as much as possible of the cancerous tissues. Sometimes for some people it's easier to take all of them out. For others, it's much more difficult depending on how far it's spread. So you remove as much of the cancerous tissues as much. Then you now follow with what we call chemotherapy. So the use of some anti-cancer medications to
Okay.
treat. There are other newer modalities of treatment, they call immunotherapy and others, but these are the two main.
Main.
So surgery and usually followed by chemotherapy.
All right. So how can this horrible uh, cancer be prevented? This ovarian cancer, how can it be prevented?
Okay, thank you. Ovarian cancer does not, unfortunately, fall into one of those conditions, medical conditions that have clear screening method or screening modality.
What kind of horrible disease is
Yeah.
this?
So yeah, there are some things to do that reduce the risk. For example, the use of what we call oral contraceptive pills seem to confer protection against ovarian cancer.
Really?
Yes.
Oral contraceptive or that
Pills.
oral pill can
Yes.
help to prevent
Yes, it does. Prolonged use of it has its own
its side
tip anyway.
effects.
Since we're
Yes.
talking of cancer, we'll get to cervical cancer.
Okay.
Because prolonged use is a risk factor for one of the risk factors when we
Oh.
start talking about cervical cancer.
Oh, well.
So it protects against ovarian cancer. Then the other thing is genetic testing. So I've heard some celebrities who have had to go and do what we call remove their breast mastectomy and take
Yes.
out their ovaries and all that.
Yes.
So those people who, for some reason, that their parents they found out that they have that the abnormality in some of those genes like I'm talking
Okay.
about. So
So-
which means they are at high risk for it. So what they do, those people do, if they have finished or completed their family size, that's term, it means they finished childbearing.
Mm.
So some of them they just go do surgery to take out the ovaries, the uterus, and all that. So we call prophylactic surgery. Not like there's a problem then.
Yes.
The ovaries are fine at that point in time, but because once there's that genetic, or there's increased risk. So in those people with that genetic problem, what do you call it, abnormalities, their own ovarian cancer could develop even at much younger age. Then there's also a small variant of ovarian cancer that occurs in young girls,
Really?
including teenagers. Yes, they call them germ cell tumor. Luckily for those group, they do better with treatment. Uh, you see that as young as 12, 13 teenagers, they can have those what we call germ cell tumor. They grow quite fast somehow too. So because they grow quite fast, even in the early stage, they could get so big such that it- you the patient presents to the hospital because there's a huge mass. So,
Okay.
but it's still in a very early stage. So at those time, they get surgery done. Commonly, they occur on one side, so which is a good thing. So the ovary is removed. They're given chemotherapy, and they're usually fine. So for those, that's another variant that occurs in much younger girls. But ovarian cancer generally occur with increasing age.
Wow. Anything about cancer can be frightening. I don't. It's a horrible disease.
Yes, cancer is.
And not to talk of this ovarian cancer that you can't even detect it at an early stage. So I think the best is just to, if you have completed your family cycle, just remove your. Well, is it easy for one to go in when you know you don't have any problem to remove your ovaries? It's not easy psychologically
Yeah,
to do that. It can be very
it,
frightening.
it is. One other thing we advise people to do is sometimes when you have some of these recurring symptoms and you keep going, they keep
Okay.
saying, uh, giving you symptomatic treatment, it looks like ulcer or kidney. So could- nice you see your gynecologist, they do a scan, do a transvaginal scan, it's a type of scan that gives a clearer picture of the ovary and all that. There are some blood tests we do also to check
Okay.
some what we call markers to just see. They're not very specific. It doesn't always not tell that this is exactly, but they could help. So and they could help to pick up this ovarian cancer at early
As
stages.
early stage, okay.
Because usually, like I said, by the time you're really coming with the clear symptoms,
It's
they
at
are most
an
likely
advanced
So,
stage.
so another thing with very regular health checks to be
Okay.
helpful. People do annual checks where they do imaging and all that. So by the time we're seeing, well, maybe this ovary looks big or it looks abnormal,
Yes.
then you could go to intervene a bit early. So regular health checks could help.
Really
Yeah,
help.
to some levels.
Okay, thank you, Dr.Dase. I think at this time we will take a musical break to resume in a few minutes. Don't go anywhere. Dear listeners, welcome back to Radio Maria 91.3 FM. We're still on Life Essential Talk discussing cancer, ovarian cancer, and very soon we will go into cervical cancer. Okay, so Dr. Dase, without wasting much time, let's hear everything about cervical cancer, the causes, the symptoms, the treatment, the prevention tips.
Okay. The cervix is the lowermost part of the uterus. The uterus is what we call the womb
Mhm.
typically. So it's more like the opening to the womb, or in lay terms sometimes we say the door to the womb. So for instance, when women are in labor, we talk about dilatation, say opening. So that's the cervix, which so that's the cervix can be affected by cancer like other uh, many other organs in the body. But there's a good part to cervical cancer. It's one of the should I say the success of preventive medicine around the world. One of the huge success of preventive medicine, and generally it's the fourth most common female cancers in the world.
Yes.
But in developing countries like Nigeria, is actually the second most common. In some studies in some parts of Africa, it's actually the leading cause of cancer. So why develop towards having to deal less with cervical cancer, we are still grappling with it. So, like I said, there are over 500,000 cases worldwide each year, close to 600,000, and they account for almost 300,000 deaths. The majority of those deaths are in developing countries
Okay.
like ours. And as we'll get to later, it all boils down to lack of screening in our environment. So, uh, before we get there, so what the cause of cervical cancer? So, unlike ovarian cancer and some other cancers that are not so clear, uh, most cases of cervical cancer are caused by a virus that is called human papilloma virus, HPV.
Okay.
HPV virus. So the cause of cervical cancer is known. So HPV is the commonest what we call sexually transmitted infection. So almost every sexually active woman has had HPV at a point or the other. But usually your body clears
The
the
HPV.
virus, yes.
Okay.
However, sometimes the infection persists, and those viruses could get integrated into the cells of the cervix and cause changes, lead to the cancerous change. So, for instance, people who are immunocompromised, what we mean immunocompromised, their immunity is
Low.
suppressed
Okay.
and low. For example, in situations like HIV/AIDS, especially those that are not on treatment, where their immunity is very low, and they have
There's those that have underlying other conditions.
conditions that suppresses immunity.
Okay.
So that's what I mean by immunocompromised. So
Okay.
so those people at higher risk of having the normal HPV infection becoming changing causing cervical cancer. The HPV, there are lots of them. There are two groups mainly. One, there are those we call carcinogenic and the non-carcinogenic. So some of them do not cause cancer. They could cause some genital warts and other. They do not. So if those ones are present, they're not going to cause cancer. Then you have the groups that are carcinogenic, which means they can't cause cancer. But even with those carcinogenic, most people will clear them. Like I said, your immune system usually clear them, so they come on. However, in some situations they sort of persist. So that is the primary cause of cervical cancer.
Okay.
So there are conditions that increase the risk for having cervical cancer. Like I said, people who are immunosuppressed, people who are taking drugs for example, transplant patients, they have to give them some drugs to suppress their immunity so that they don't reject the organ. So such person is at risk, higher risk.
Okay.
People with what they call HIV/AIDS with advanced stages, they
Okay.
have such risk. People smoking causes that increases the risk for cervical cancer.
Okay.
Prolonged use of oral contraceptive pills, as I mentioned earlier. So why it protects
Is it
against-
only oral?
Yes, right. So why
Okay, only
oral
for now,
contraceptive, yes.
oral.
So while it protects against ovarian cancer, it sort of increases the risk for cervical cancer.